the power of one. Today, we are going to be loving on our amazing seniors. We're going to be speaking about geriatric care. And today, as my guest, I have Dr. G. Welcome to the show, Doctor.
Thank you for having me. So excited to be on your show.
You're more than welcome. Doctor, please explain what geriatric care is.
Definitely. So geriatric care pretty much focuses on our elderly population, which is defined as patients above 65 years. It's kind of hard to define what the age criteria is, but historically it's been 65 years of age and older.
Should someone actually have a geriatric care physician and their primary care physician, say if they're 65 years of age and older?
It's not necessary. I feel like a lot of primary care doctors can care for patients above the age of 65. If there are any specific concerns regarding cognition or behavior, certainly they can consult us, and we're more than happy to provide additional services.
So tell me about what medical problems can arise when we become seniors.
Yeah, so with aging, unfortunately, there are a lot of issues and concerns that can arise, such as incontinence, falls, memory concerns, as well as emotional stressors, and also just general health concerns. And
that can just come with age. Doesn't mean that you did not live a healthy lifestyle. It just comes with age.
Certainly. I'm definitely lifestyle does help to prevent some of these conditions, but sometimes even with the right lifestyle management and diets and exercise and even genetics, some people do have some of these issues.
My dad, Reverend Dr. John L. Payne, in June 20th of 2022, he was diagnosed with heart failure. And my dad was the healthiest person, you know what I mean? I think he was the most buff senior you probably would have ever seen. He just turned 80 October of last year, but he was diagnosed with heart failure. Not only with heart failure, it's TTR, and I'm going to jack up this actual amyloidosis.
Yes,
I'm jacking up the word.
That's fine. No, you said it right.
Oh, okay. So he was actually diagnosed with that, which is like a rare heart disease, and we were so surprised. My mom said, "I knew arthritis would take my husband out from heart disease." But they did say that this was something, and this particular heart disease could either be genetic or come with age. And his is one that came with age. Tell me something about dementia. And am I saying this right? Is it Alzheimer's?
Alzheimer's, yes.
I remember hearing years ago, someone said that someone I knew, an elderly person, that she passed from Alzheimer's. And I'm just thinking that's a disease, an illness that just affects your memory. Expand on both, please, and how it can affect someone's life.
Yeah, definitely. So I get this question a lot. A lot of people have the assumption that dementia and Alzheimer's are synonymous, which it really isn't. So the way I like to describe it to my patients is that dementia is pretty much an umbrella term. And so there are different types of dementia, and Alzheimer's is one of the most common type of dementia. I would say about 2/3 of patients who are diagnosed with dementia have Alzheimer's. And so with Alzheimer's, what happens is that there is impairment with your cognition as well as your independence. So the combination of both classifies you as having dementia. If you have just cognitive impairments but no functional decline, then that's not dementia. So with Alzheimer's, what happens is that you pretty much regress. And so there's a slow regression. And one of the analogies that one of my attendings in fellowship used was a ladder. So in life, you go up the ladder. You start to crawl, then you start to walk, and you're able to feed yourself. And then you go to school and you learn your A's and ABCs. And then you start learning more complicated things like trig, and you have a career and so on and so forth. Well, with Alzheimer's, it's like you're going down that ladder. So whatever you learned first, or whatever you learn last, I should say, is what you lose first. And so you gradually decline into a childlike state. And that, unfortunately, is what takes our patients. They have difficulty holding their head up like a child, or they have difficulty swallowing or feeding themselves. And so that's what usually is the cause of their demise.
I see. Now, what causes them to ask the same question over and over again? My grandmother, she's no longer with us, but she was in her 90s when she passed away, and she had dementia. And she would ask, we would have a conversation, but in this conversation, she would ask me like the same question, probably 10 times in that same question.
Yeah, so there definitely is there's a deficiency in certain cognitive domains. So with Alzheimer's, unfortunately, patients, become confused. They have very short-term memory. If you ask them about kind of like childhood memories, they're able to recall it just like that. But if you ask them about something that was said to them recently, then they have difficulty retaining that information. Therefore, they constantly are repeating themselves or asking the same questions.
So with going back to my dad, when we first found out he was diagnosed with heart failure, I know those doctors were tired of me because I was is it treatable? I was like, can you fix it? Is it curable? And they're looking at me like it's treatable. So we can treat it, can't reverse it, but we can treat it. Is that the same thing with Alzheimer's and dementia?
So there are several medications out there, and these medications, they have some limitations. So we cannot reverse dementia. We cannot, give you back all the memory that you lost, pretty much. And so what it does is it essentially slows down the progression. And in some patients, there is a mild improvement in their cognition. Most of these meds really do help with the functionality, so they're able to function more. They're a little bit more independent, but it's very limited. It's very limited. And there's data, the data out there just shows that there's very limited evidence that it helps patients, slow down their cognitive loss. And what I tell my patients, which is, a little unfortunate, but only few patients actually respond to these medications. And so that's why we like to really push the non-pharmacologic options or treatments, such as support for the caregivers, addressing any safety concerns. We like to, provide a stimulating environment for patients. We like to, tell the family reassurance is always key. Redirection, reorientation is always key. So those methods have actually shown to delay or improve their cognition or the cognitive decline, so that they're able to function and remain independent.
Dr. G, are there contributing factors that one may have had during their life which will cause them to have Alzheimer's or dementia? Or is it just like my dad's situation with that heart failure? Could it just come on with age?
Yeah, so with dementia, I always tell patients the biggest risk factor is age and family history. So with age, as you get older, there is normal, cognitive loss with aging. It's just normal. You forget appointments. Sometimes, you forget people's names. That's normal. But in patients who have family members, specifically first degree family members, such as, mom, dad, brother, sister, if they had dementia and they're above the age of 90, about half of them will develop dementia themselves. So, there's age and family history is a huge contributor, but then there are also some modifiable risk factors, such as your diet, making sure that you're eating the right foods, also controlling blood pressures and diabetes and avoiding excessive alcohol use and smoking. So these are things that are modifiable that you can actually, address and work on to prevent memory loss or, dementia.
Does stress play a factor?
Definitely. So when I see a patient in the office and they're coming in for memory concerns, I try to rule out things that could mimic dementia. So we call this pseudo dementia. And so patients who have, anxiety, depression often can display signs of dementia. So they, become withdrawn, or they have problems with concentration. And so definitely, if someone is stressed or someone's anxious or depressed, you want to address that first to make sure that that's not, what is causing some of their, memory concerns or issues. And then, you can address the other concerns.
Okay. And I know that's kind of a loaded question because we all have stress and, dealing with stress and anxiety. I think we all go through that through the course of our day. So with Alzheimer's and dementia, can young people get that, or it's just something that occurs in seniors?
No, young people can certainly develop dementia. It's often seen in patients above the age of 65, but there are certain types of dementias that do present in patients younger than 60 years of age, such as frontal temporal dementia, which usually manifests as having some, memory loss, as well as difficulty with holding certain things, such as, they have problems with disinhibition, meaning that they say things or do things that they wouldn't normally do, whereas you and I would be like, that's not appropriate. But for them, they don't have that kind of checkpoint. And so they'll say things that are inappropriate, they'll do things that are inappropriate, and then they also have some memory issues. Another type of dementia that can present in younger patients is someone who had a stroke, and that is called vascular dementia. And so if you have a stroke, depending on the location of the stroke, you can have some memory issues. And so unfortunately, we're seeing patients who are presenting at a younger age, 40s to 50s, with a history of stroke. And unfortunately, they have some signs of vascular dementia.
With someone who had a stroke and then they had that memory loss, can that be reversed? I know dementia, can't be reversed, but in that situation, is that something where the person may actually regain what they had before the stroke?
Yeah, unfortunately not. You may regain some of it, but a lot of times there's this stepwise, kind of like a stepwise appearance or manifestation. So, you're at a certain point and that stroke really brings you down to another step. And if you have another insult, it brings you down to another step. So it's really hard for you to get back up to your original state. So unfortunately, yeah, it's irreversible most of the times.
So I have this aunt. I guess I'm putting all my family business out here, which is okay.
That's okay.
Okay. And it's good for people to know that we have people in our family that suffer from things also.
Exactly.
I have this aunt who she did have 2 strokes years ago. But there was She actually got on a bus one time and she forgot where she was going.
Mm.
That was one incident. And then my cousin, her son, said, you know what, I'm just going to have her move with me. It's a very good idea. And there's been a couple of times where she's just like, where am I?
Mm.
And she's just going to her family doctor, but I don't think that they're getting the proper care for her that she actually needs. Would you recommend her seeing a geriatric doctor and not just her regular physician?
Certainly, certainly. So geriatricians are trained to care for patients with memory concerns, and you can a primary care doctor can start the workup if there is any concern. To diagnose dementia, it's a clinical diagnosis. It's a lot of times we don't use imaging or a blood test to diagnose dementia. We use it to rule out certain conditions that can mimic dementia, or if we feel as though a patient has a clinical presentation that is not typical for dementia. But a primary care doctor can certainly diagnose dementia with by getting some information about just kind of their day-to-day activities, their functional capacity, how much they're able to do, and then do a physical exam as well as a cognitive test. And so the cognitive test really helps us to, objectively identify if there is any memory concerns. Because a lot of times people will say, oh man, I forget things all the time. I forget things, but then they don't have dementia. In that case, they either have, they're aging normally and they're a little bit more forgetful, or they have something called mild cognitive impairment. And so, like I said before, if a primary care doctor, does all of that and they feel as though, okay, well, I don't feel comfortable, or the patient feels like they need a little bit more support or care, more than happy to see a geriatrician who can really focus on those things and also provide them with resources, for the caregiver and the patient, so that, they can address their issues.
What other issues would arise for seniors other than Alzheimer's, dementia, or heart disease? What other issues may come up?
Yeah, so you can have gait problems. So, you become unstable and increase your risk for falls. You can have incontinence where you have accidents. It could be from, accidents with urination or your bowel movements. You can have issues with, diabetes, and you can have issues with constipation. I mean, there's so many different things that can arise, but in the geriatric office, what we see a lot of is fall management, memory concerns, and then also just providing just support to family members. So, trying to keep the patient involved in the community, trying to maintain their independence, and also just giving the caregivers or the family members reassurance as to what to expect as you age. Because, a lot of times, we see other family members or we see our friends and they have one experience, but then we kind of expect the same thing to happen to our loved ones or to us. And that's not necessarily the case. So I would say, the biggest things that I really see is like incontinence, falls, and memory, but there's certainly so many other things that we address.
And Dr. It amazes me that when you're older and that you fall, that can actually put you in a hospital and possibly cause death. So I had an aunt who was older, and she was in her 90s. She was able to walk to the store, go where she needed to go. But one day she was coming out of the store and she actually fell. She was in the hospital for a little while and she passed away. Tell me and tell the viewers how a fall can actually affect the senior so much differently than if we fall.
Yeah, definitely. So with falls, basically you lose your independence with the falls. And so the fall itself, just, having a fracture where you have to be bedridden, it really does affect older patients. They're just not as involved. They become more depressed, more withdrawn. They don't want to eat. But the actual fall itself can increase the risk for ulcerations, like, sacral ulcers, wounds, any bones that, any fractures or broken bones can increase your risk for blood clots. So there are just a lot of things that can, that can arise from a fall. Same thing, if you're not as active, maybe you're not exercising, you start gaining weight, you start choosing, the wrong foods, and that can contribute to other things. So unfortunately, there's a cascade of events that happen after a fall, and that's why we really try to prevent them. We do med reconciliations at every visit to make sure that there isn't anything that could contribute to the fall. We try to, identify if a patient has osteoporosis and treat it so that it could decrease their risk of a fracture if they fell. We try to address any gait concerns or problems with balance, so that we can reduce the risk of falls. So, having a fall, it doesn't just mean, okay, you hurt yourself or you could possibly fracture something. It can result in, a lot of complications.
Let's speak for a minute about health insurance.
Mhm.
I am sure that, and like you said, you giving support to those caregivers. So what about those seniors that we're speaking about falls and things of that nature that may need like the stair lift in their home?
Mm-hmm.
I don't believe that if you're not a veteran, your insurance covers it. And I think they are very, very expensive.
Mm-hmm.
What do you do for that family that needs that medical equipment in their house, and it may not be covered under their health insurance? Is there a way like around that?
So, unfortunately, there are a lot of durable medical equipments that are not covered by insurance. Thankfully, there are some government resources that are available for patients who are either veterans or who are widowed, or certain circumstances, your finances, they can sort of offset the expenses, but a lot of times those things are covered by the family. Things like, walkers, rollators, canes, those things can be covered. But when you start talking about things that are a little bit more sophisticated, like a stair lift, usually that comes out of pocket.
Yeah, and we see that. My dad and I had many conversations when he was in the hospital, because he had like 5 hospital stays.
Oh.
And the pill that he takes,
yeah,
$600 a pill. So, and they wanted him to get a 90-day supply, and we were just like, and that would have been $4,500 every 3 months. So what we spoke about often, my dad and I, was how many people actually pass away because they can't get proper medical care. They can't afford their medication, which is sad. So Dr. G, before we close, please tell all the viewers why it's important to get geriatric care.
Definitely. So I want to say is that it's important to get any type of care. It doesn't have to be geriatric care. But if you are of the age, like I said, 65 or older, or even approaching that age, 63, 64, certainly you can pursue seeing a geriatric doctor so that we can try to maintain your independence, as well as prevent certain ailments, and also identify if there are any signs of dementia. So, you know, in all, I think that seeing a doctor is definitely important, just to, you know, get your preventative screenings and making sure that, you know, you're in the best health that you can possibly be. But to see a geriatric doctor would be best for those who are older, who, you know, have the concerns that we mentioned before.
Thank you so much for joining me today, Dr. G.
No problem. Anytime.
Thank you so much for joining us today. I ask that you love on all the seniors in your life. Make sure they are getting the best care possible. During retirement, they want to be able to relax on the beach without any medical concerns. Please love on all of the seniors within your family and within your circle. Peace and love.